我们8号、7号，我们都还在搞那种病人转运那种，还在搞隔离。
然后放开了以后，就是红牙的病例就起了。
今明两天有可能说得去3月然后奏效。
These are the scenes I witnessed while traveling through southwestern China's remote areas during the first week of January. It's just been 3 weeks since the country dismantled its zero-COVID policy, which largely shielded the country from the virus for 3 years. But now, the virus is spreading like wildfire.
There are fears the caseload could shoot up during the Chinese New Year holiday next month.
农村地区疫情防控到了最吃劲的时候。
Contrary to initial reports that predicted a delayed COVID surge than cities, I was surprised to find out that infections in many remote corners had already peaked, including here in Sichuan province. After mass infection, hospitals in these places now struggle to cope with severe cases. I saw hundreds of people, many of them elderly, hooked to oxygen tanks on hospital beds. Healthcare workers, previously tasked with routine checkups, now suddenly find themselves in the front line battling COVID. Meanwhile, locals are trying to make sense of the jarring reality of their newly gained freedom. This is a historical moment that marks the beginning of the end of an era, the memories of which will linger for times to come. In remote areas, county hospitals like this one I visited in Zitong County bear the brunt of treating severe patients. These hospitals are significantly smaller and under-resourced than those in the city.
然后放开了以后，就是红牙的病例就起了，然后这个6、700个，其实真的基本上大部分都是新冠病人。那个啥子新冠。
Dr. Yang Lin of Zitong County People's Hospital was struggling to catch her breath while demonstrating to colleagues on how to use the ventilator. As a local COVID expert, she was still recovering from the infection. But even when she was sick, Dr. Yang worked while hooked to an oxygen tank. Some 80% of the hospital staff were infected last month.
他们昨天哭今天哭，我一直安慰他们，工作还得做，这咋个办嘛？我告诉我全国医院都是闷的，然后领导也得积极给我们想办法。
I was told that Dr. Yang recently lost her father, who showed symptoms of COVID infection, but she hasn't had time to deal with personal trauma.
这一般高龄10多，今年老年人太难过了，我都感觉我简直老年人太着急了。
Beside the shortage of specialist physicians, the hospital was also short on basic drugs to treat chronic diseases as market demand soared, let alone COVID treatment medicines.
昨天我给换了个药，抗病毒的药，因为那个药没得了，我就给换了一个。
While I was there, doctors said they had replenished the stock. Three hours away from Zitong, I saw a grimmer picture in Sichuan County, which is more remote and impoverished. Almost all wards at the main hospital had been converted to treat COVID patients. I counted, and there were more than 500 beds, and I was told that they had no space for new patients anymore.
今明两天有可能说得去3月然后奏效。
Here I met Ms. Zhou, who works and lives in Shanghai. She was waiting outside the hospital ward, hoping that her 83-year-old mother would get better.
我觉得他应该是自己，他们又没做核酸，他们自己都不知道，就是进来了，他们也没做核酸，也不知道，他完了全都是当感冒的那样。
In this county, people don't know for sure whether they have or have had COVID. Many medical facilities like this one have stopped testing and tracking infections. Who'd have thought that it'd come to this just over a month ago? While county doctors work tirelessly to save lives, taxi drivers told me they've seen more family funerals this winter. I drove past one myself. Family members of 79-year-old Ma Shouying suspected she had died from COVID, but her death was attributed to renal failure.
在家里面这个吃药，然后不管用，然后我们就把他送到医院里面去。 持续了几天，也没见好转。然后医生让我们转院，然后说建议效果不大。
While speaking to the family, I found myself attending the funeral as a guest. I couldn't bear not knowing who Grandmama was like as a person. She couldn't just be another statistic. The more I listened to the locals, the more I wanted to know. How were people making sense of everything? A doctor shared his genuine observations with me, but under the condition of anonymity.
我们8号、7号，我们都还在搞那种病人转运那种，还在搞隔离，真的是这个放开的呢，这个动作呢，力度呢有点大了。
I wondered if county hospitals were barely coping with the virus surge, how were people in smaller towns and villages getting medical services? To know more, I met Dr. Fan Jibing. Nobody takes the pulse of local health better than village doctors like him. He was on his routine patrol in Qingzhou, a village 30 minutes away from the Zitong County Hospital. Until December, he had treated no COVID patients, but now he's doing whatever he can. Without proper means to test and treat, Dr. Fan Jibing said he mostly distributed medicines and advised those with severe symptoms to visit a hospital.
退烧的一般呢，对乙酰氨基酚呐，这些退烧的药这是有的，还有止咳的药，小孩子退烧药就没得。
Oddly, many locals weren't really concerned, or they may have gotten used to the hardships that come with living in rural China. In more townships and villages, we heard of traditional winter gatherings, along with COVID-related anecdotes. Miss He was attending a 500-person wedding. He said he has neither had COVID nor worried about contracting the virus.
因为我已经经过那个感染高峰期了。
The gap in people's understanding of a global pandemic that has claimed millions of lives is difficult to miss. And while many young people have recovered and returned to a fairly normal lifestyle, it's a different story for the elderly. At Mr. Wu's house, I saw his 92-year-old mother lying in bed. Miss Long had been sick for 3 days when I met her.
原来周到，说啊，就里头个厕所，就在外头烤火，就坐到那儿吃饭，咋对法？都是那个得那个病的了以后，你就没法了。
Miss Long could have contracted the virus from her children, who worked on construction sites in the city, before coming home for the Lunar New Year holiday. They told me that they themselves had just recovered. For the family, COVID is something they just wanted to get over with.
封的严，搞笑又封呢。过段时间又封过段时间封就把那些工人都封起来的嘛，都没做到好多活路，今年没干到好多活。
今年没得收入。
今年下降60%啊，到50%至少呀。放开有放开的好处，封到有封到的好处。放开就是人们自由了。
People in rural China have decided to pick up the lifestyle that they once led. In the past few days, I've listened to many stories. I saw weddings and funerals, life and death. As I prepared to leave and reflect on my trip, I couldn't help but think about the rural-urban divide, as well as the past 3 years. The long war against an invisible enemy. No one has been spared.